Hi, my name is Andrew Nielsen, and I'm a master's student at Brock University in Ontario, Canada. The study I'm presenting today was conducted with my colleagues, where we examined the long-term association between family support and sleep problems among lesbian, gay, and bisexual individuals. In the general population, sleep's been identified as one of the most important determinants of both mental and physical health, and good quality sleep has been shown to be crucial for healthy brain functioning and emotional well-being. But the problem is that a lot of adults aren't getting enough sleep every night. A survey of UK adults reported that over 2/3 of respondents believe they're not getting enough sleep every night, and almost a quarter reported sleeping less than 5 hours per night, despite the 8-hour recommendation for good quality sleep. Now, there's a strong evidence that shows link between poor sleep and a number of preventable diseases. So adults who have short sleep duration are 48% more likely to develop or die from coronary heart disease, 15% more likely to suffer stroke, and 91% more likely to report a diabetes diagnosis compared to those who have regular sleep. There's also a huge economic toll that poor sleep can have in the UK. Recent studies have shown that the UK loses up to $50 billion in GDP and over 200,000 days of productivity due to sleep problems. The research on both the health and economic consequences of poor sleep emphasizes just how important it is to identify who's at risk of experiencing sleep problems and figuring out how exactly we can address this issue. LGBT individuals have worse sleep problems than the general population. So comparing sleep problems among the LGBT population, lesbian, gay, and bisexual individuals compared to heterosexuals, there's a significant disparity as shown by previous studies. One study reported that 17.3% of LGBT individuals experience sleep problems, whereas only 12.2% of heterosexuals experience these problems. Another study compared gender and sexual orientation differences in sleep problems, and it was found that gay men experience 32% higher prevalence of trouble falling asleep than heterosexual men, as well as a 22% higher prevalence of feeling unrested. Bisexual women had a 43% higher prevalence of trouble falling asleep compared to heterosexual women. Also, because there's a possibility that some LGBT individuals might conceal their sexual orientation on surveys or not even participate because they might be scared of being outed, there could be many more problems than previously reported. Few studies have investigated the social causes of LGBT sleep problems. Prior studies on social causes are pretty limited, but some have included looking at low perception of neighborhood safety, low support for same-sex marriage, and financial hardships. Our study will focus on investigating family support as a social factor for LGBT sleep problems. There haven't been many studies that have looked at how changes in family and friend support over time impact LGBT sleep, but this is important to look at because we still don't know if, for example, poor social support over time still affects sleep, regardless of how long someone has dealt with rejection or discrimination. Another important reason for this study is because if family support is in fact associated with long-term LGBT sleep problems, well, could someone's friend support be a sufficient replacement for their lack of family support? It's common in the LGBT community to have chosen family, referring to the social support that isn't their biological family, and research has shown that these chosen families are very important in the face of family rejection. But is this support actually effective in reducing sleep problems? Our study will try to address these questions, and by using multiple UKHLS waves, we ask the question, does family support have a long-term effect on sleep problems for sexual minorities? In order for us to find evidence for causal inference that family support affects sleep problems, we made use of lagged outcome variables. In this case, there was an average of a 24-month lag from when respondents were asked about family support to when they reported sleep problems.
So for our first time point, we used the friend and family support that was collected at wave 2 to predict the sleep problems that were reported at wave 4. For our second time point, we used the friend and family support collected at wave 5 to predict the sleep problems that were reported at wave 7.
Our sample of participants included 1,703 individuals who identified as either lesbian, gay, bisexual, or something other than these. To measure friend and family support, the survey asked 6 questions which aim to capture their empathy, their reliability, their level of criticism, understanding, or tendency to disapprove or annoy. And the scores were then summed and standardized to represent varying degrees of support. We then captured sleep dysfunction, duration, and quality. If a respondent answered that at least 3 days of the week they suffered from the inability to get to sleep within 30 minutes, coughing or snoring loudly, waking up mid-sleep or too early, or having trouble staying awake during the day, they were considered to have a sleep dysfunction. If they slept less than 6 hours per night, they were considered to have short sleep duration, and if they reported their sleep quality to be poor or very poor, they were said to have poor sleep quality. We took into consideration anything that might also affect sleep, including various socio-demographic factors, health status, substance use, age, and the use of sleep aids. We then used a mixed effects logistic regression model to measure the long-term impact of family support on sleep problems. So to give you an idea about the sample distribution, out of our sample of 1,700 sexual minorities, roughly 1/3 were homosexual, 1/3 were bisexual, and 1/3 identified as something other than these two. So some of the prevalence of sleep problems in our study: 43% of our sample reported sleep dysfunction, 20% reported poor sleep quality, and 16.4% reported short sleep duration. We found that family support was independently associated with all three of our sleep outcomes, which would be sleep dysfunction, poor sleep quality, and short sleep duration after 24 months. For sleep dysfunction, each standard deviation increase in family support was associated with a 10% reduction in the odds of experiencing sleep dysfunction, a 15% reduction in the odds of experiencing short sleep duration, and a 10% reduction in the odds of experiencing poor sleep quality. But when we looked at friend support, there was actually no association with any of our outcomes. Also, we found that the effect of family support was similar across different combinations of LGBT and gender groups. Based on previous studies which show how important family support is, our findings aren't that surprising. And even though effects may not seem large, we now have great evidence that even after 24 months, our study participants were still affected by the family support. It's really interesting that friend support didn't really do much to reduce sleep problems, despite many people in the LGBT community relying strongly on their chosen family and friends as their main source of social support. We also found that whether someone was 16 or 65 years old, there wasn't actually a difference in how family support influenced them. So now that we've established that poor family support is associated with long-term sleep problems among LGBT individuals, well, how can these findings be used to fix this problem in the UK? So if LGBT individuals are having sleep problems, their family care provider should be regularly assessing their level of family support. For example, if a patient with poor sleep has a strained relationship with their family, their doctor may suggest family counseling. Sleep interventions, which are also designed with LGBT patients in mind, should be also recommended, but there are currently none available, so these should be developed. The government should also consider prioritizing funding to organizations that focus on public advocacy of LGBT people. Organizations like FFLAG and the Manchester Parents Group offer support to UK families to help them embrace and accept their LGBT children. And since we found that family support is so important to LGBT individuals above and beyond their friends, these organizations can advocate for healthy family relationships. Our study concludes that there's a relationship between family support and LGBT sleep, adding evidence to the current body of research of the persistent effect of adequate family support on the important processes of sexual minority health, such as sleep, while suggesting that other sources of social support, such as friends, may not be enough to reduce this disparity. Thank you for listening to my presentation.